guys, welcome back to the channel. So last class we have started with what is cancer. We'll be dealing कि कैंसर कैसे होता है, क्या होता है, मतलब बेसिक थिंग अबाउट कैंसर कि आगे जो भी हम लोग ट्यूमर पढ़े तो एक बेस हमारा रहेगी कि एक्चुअल में कैंसर में होता क्या है. तो लास्ट क्लास वी हैव सीन दैट it is a product of unregulated proliferation और undifferentiated cell होते हैं mainly. Differentiated cells are not responsible. Undifferentiated stem cell, precursor cells जो भी हैं they are responsible. So we have like started a brief introduction about what is cancer and metastasis क्या है and what is malignant में metastasis होता है. Okay, just dealing it further. Okay, let's start. Now coming to cancer stem cells. What are cancer stem cells? Cancer have been found to retain self-renewing stem cells that repopulate the cancer mass. So it retain that stem cell which are self-renewing, जो खुद ही बनते जाते हैं वापस and make up for cancer cells that are slowed, die of a normal age-related cell that is apoptosis or are removed by the treatment. Okay, these cancer stem cells are the most important cells in the tumor mass, but there are more than one in each cancer. सिर्फ एक cancer stem cell नहीं होते हैं, though they are the most important cell, but they are found in numbers, not a single stem cells. Okay, it is these cells that are now the focus of most chemotherapy, and they are the reason why multi-drug therapy and prolonged treatment of all kinds are becoming more frequent and are associated with better outcomes. Okay, so these स्टेम सेल्स आर द फोकस फॉर कीमोथेरेपी. तो जब हम लोग कीमोथेरेपी करते हैं और टारगेटेड कीमोथेरेपी या टारगेटेड ट्रीटमेंट जब हम लोग करते हैं तो दीज आर द फोकस ऑफ सेल. Okay, for multi-drug therapy also these are the cells associated for best outcome. Okay, now coming to the causes of cancer. Association between a number of environmental factors and the incidence of cancer is seen. Okay, recognized causes of oral squamous cell carcinoma. Okay, we have taken oral squamous cell carcinoma because as an oral and maxillofacial surgeons we deal with, or as a regular dentist also we deal with mostly oral squamous cell carcinoma. So the recognized causes of OCC is tobacco related products, almost exclusively cigarettes, alcohol, several viruses, particularly human papilloma virus, that is 16, 18 and 32. Irradiation, chemical carcinogens such as slake lime, UV light, naturally occurring genetic defects and random spontaneous genetic mutations. So these are the mainly causes for oral squamous cell carcinomas. And there's a huge association between cigarette smoking and oral squamous cell carcinoma, and alcohol being the additive factor or causing the synergistic effect when already there is a tobacco or cigarette cause. Cancer etiology is very complex and is related to the type of carcinogen, its dose, its frequency and its application. It is also related to the synergistic or additive action of two or more carcinogens, which I was talking about. मान लो I am saying that कि cigarette की वजह से oral squamous cell carcinoma हुआ, but if the person is taking alcohol also, so it will cause a synergistic effect. Synergistic effect मतलब additive effect. So it is also related to the synergistic or additive effect of two or more carcinogens, the susceptibility of the host कितना susceptible है, and most importantly the length of a time carcinogen has interacted with host tissue, और कितने टाइम तक वो interact किया है host tissue तक. Now cancer are not formed by a one-time exposure or by several exposure over a short period. ये एक exposure से नहीं होता cancer, and छोटे छोटे मतलब बहुत सारे exposure over a short period time. It is a long process, मतलब धीरे 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 करके it happens. बिकॉज द DNA इज रिपेयर्ड बाई स्पेसिफिक DNA पॉलीमरेज एंजाइम। ये ऐसा इसलिए नहीं होता शॉर्ट पीरियड में या वन टाइम एक्सपोजर में, क्योंकि DNA इज replaced by a specific DNA or repaired by a specific DNA polymerase enzyme. Okay, that's all for today's class. We'll be continuing this in the next class. Till then, like, share, subscribe, and comment. Bye.